Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Ms. Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Charmaine Thomas from the Ministry of Governance.
Hi, I'm Verna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine, take the vaccine, need it.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. Covid-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
So we are in the community of Bells today. We are going for a list, making sure the community has a certain amount of people that get vaccinated. So we are raising awareness as well as education, as well as meeting the people, find out their concerns, why they want the vaccine, why they're not taking the vaccine, if they'll encourage their friends to take the vaccine. So all this is part of our vaccination rollout campaign. So stay tuned for more, and remember, vaccination helps. Get vaxxed today.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18, take the vaccine. To protect your family, take the vaccine. To safeguard the elderly, take the vaccine. To bring back with festivals, take the vaccine. Take the vaccine, take the vaccine. Need it. Take the vaccine, take the vaccine. Need it.
Good evening to our listening and viewing public. I want to welcome you to this evening's COVID-19 press briefing. Our focus this evening will center around contact tracing and protocols for businesses to include bars, churches, gyms, restaurants. Our presenters this evening, I would like to take some time to acknowledge them. Our Director of the Drug Abuse Prevention Unit and a member of the contact tracing team, Ms. Martha Jarvis, and the Senior Environmental Health Officer, Mrs. Isabella John. To get this evening briefing started, I would like to welcome our first presenter, Ms. Martha Jarvis.
Good evening, everyone. I would like to acknowledge the presence of Mrs. Isabella John, Senior Environmental Health Officer, Vanilla Ole, Communications Officer, the media, the entire listening and viewing audience. Good evening. Everyone who have gotten a positive antigen and PCR result would have gotten a call that goes like this. Hello, my name is, and I am calling from the contact tracing team, Ministry of Health. Am I speaking to? How are you doing? After the pleasantries, the contact tracer would engage the client in a number of questions that may seem simple but are vital to the care of his or her care or what she receives. For most persons, the conversation would be limited to about 5 minutes. On many occasions, the banter would go on for much longer, as the contact tracer would alleviate fears, answer questions, and also refer the client to another unit of the COVID-19 control. There are those, however, who would require a more extensive conversation and a second and possibly third call. That is those who will need to be transferred to a quarantine facility. Those subsequent calls are especially used to arrange transportation to the COVID care complex in Portsmouth. If you are vaccinated or unvaccinated and symptomatic, you'll also require a call from our taxi dispatch team. This dispatch team are responsible for assigning certified transportation for you to receive easy transfer to Portsmouth. Transportation is arranged based on geographic location and urgency for transfer. I'm sure we can all agree that some may require more immediate intervention than others. Families are transported together, and if there are other family members already at quarantine, efforts are made to keep them together. However, once you get to quarantine, the health team will conduct a thorough assessment to determine where best to place you. In urgent cases of a person with mobility challenges, an ambulance is dispatched for pickup. We endeavor to contact you and transfer you as soon as possible, usually within a day. So we urge you to keep your phones on and charged. Answer numbers which may seem unknown to you. Once you tested positive, if you are destined for quarantine, go straight home, pack your belongings, and await a call. The term contact tracing has been tossed about for many months, and I've been taking a few minutes talking about contact tracing, but still some persons are unclear what it entails. Very simply put, contact tracing involves tracing where a possible Very simply put, contact tracing involves tracking where a positive patient has been and who they came in contact with within the previous 10 days. Then the contact tracer can reach out to those recent contacts and advise them where and when they should get tested, where is the nearest testing site, and what protocols they need to follow in the meantime. The main aim of contact tracing is to help curb the spread of the virus. In Dominica, to curb the spread of COVID-19, the government have utilized 5 main pillars. These are testing, isolation, contact tracing, quarantine, and vaccination. So let's just look at the 5 main pillars. So we have testing, where we find out who is infected, home isolation, where we prevent further infection, contact tracing, where we figure out the people who have come in contact with a positive patient, quarantine, where we prevent contacts with infected persons, and vaccination, a tool used to reduce the impact of COVID-19. As part of providing an effective and efficient service to the Dominican populace, the unit has utilized a standardized intake form that covers demographics, symptoms, exposure, contacts, and instructions given. This information is critical for determining several aspects of COVID-19 operations. These include the accuracy in 1. Calculating the hotspots or the epicenters of COVID-19 around the country. 2. How transportation is arranged for quarantine and testing. 3. Based on the symptoms where the clients are placed in quarantine. We also use the information to get some statistical information to include age range, comparison of vaccinated or unvaccinated persons, and comparison of symptomatic versus asymptomatic persons. One critical piece of information that is needed is the number of persons in the family affected to determine the accommodation at quarantine. With every well-oiled organization, there are obstacles that can hinder how effective and efficient it operates. These obstacles include incomplete and inaccurate addresses, symptoms given, telephone numbers, and vaccination status. Persons not willing to follow protocol, for example, going to quarantine or refusing to take an antigen test. And most importantly, some persons simply vanish into the unknown by turning off their phones or not answering and reappearing when the 10 days are up for a retest, so they are medically cleared. Despite all these challenges, the contact tracing units have made significant progress in reaching out to the general public. As I close, let me take the opportunity to thank the general public for their continued cooperation with contact tracing. For the past 2 months, we have noticed a vast improvement in the public's response for our calls and have provided the unit with much needed information. Without your cooperation, our efforts would be futile. I would also like to commend the efforts of our small and effective team supported by health promotion, drug prevention, dental health care. We also have persons from primary health care who have supported us throughout this endeavor. We also have support from the taxi dispatch, fire and ambulance services, and we can assure you that we will continue to work vigorously as we strive to overcome this pandemic. Let's remember, together we fight. Together we wear our masks correctly. Together we wash and sanitize our hands and commonly used surfaces. Together we physically distance and get vaccinated. I thank you.
Thank you, Ms. Jarvis, for such a detailed and comprehensive presentation. At this point, I would like to welcome our next presenter, the Senior Environmental Health Officer, Mrs. Isabella John.
Ms. Martha Jarvis, the Director of the Drug Abuse Prevention Unit and a member of the Contact Tracing Team, Ms. Vanilla Ole, Communication Officer, the media, the listening and the viewing public, good evening. Officers within the Environmental Health Department continue to give support to the Ministry of Health, Wellness and New Health Investment in ensuring that business places and workplaces are in compliance with the health and safety protocols that were established. With the responsibility for monitoring, officers have been doing daily visits to business places and workplaces that are open and offering service to the general public. Health and safety protocols were established to ensure that these establishments implement control measures to safeguard the health, safety, and welfare of their employees, their customers, or their clients. To date, protocols have been established for the following businesses: barbershops, hair salons, manicure and pedicure facilities, gaming establishments, gyms and other fitness venues, restaurants, churches, and other places of worship. Daycares and preschools have not yet been given the permission to reopen, and therefore, if any of these facilities are operating, the owners will be asked to immediately close during visits. For the barbershops, the hair salons, spas, pedicure, manicure facilities, prior to opening, all owners were required to contact the Environmental Health Department for a pre-inspection. The pre-inspection will include a visit to the facility to determine if the owner has in place all the requirements of the protocols. And these includes signage to encourage social distancing, hand hygiene, respiratory etiquette, and wearing of masks. These signs must be visible and posted in conspicuous locations. Hand sanitizing dispensers, and if it is feasible, hand washing stations equipped with liquid soap and paper towel must be installed on the entrance. Hand sanitizers must also be available throughout the facility. The general public must be informed of the number of persons that are allowed to be inside of the facility at one time. All owners are required to keep an appointment log. Adequate time must be given between each customer to allow for cleaning and sanitizing of the surfaces and equipment. All workstations and furniture must be placed 6 feet apart, and if the equipment or the furniture cannot be removed, then the number of employees must be reduced and markers must be placed on these items to inform the general public that they are out of use. A key control measure is cleaning and sanitizing of all the surfaces and the equipment, especially after each client, at the start and at the end of the workday. All employees must have a basic idea of what has to be cleaned, when it should be cleaned, and how it should be cleaned. All facilities are required to have adequate supplies of cleaning and sanitizing products. And some of these products include Lysol spray and wipes, at least 70% alcohol, bleach, and barbicide for the equipment. In the facility, all reading materials such as magazines, newspaper, books, and frequently touched items must be removed. Mandatory wearing of masks must be enforced at all times. Because of the close contact between the customers and the employees, an additional protective equipment, which is the face shield, must be worn by employees together with a surgical mask or N95 mask. No cloth mask must be worn by the employees. All facilities with control measures in place will be given a certificate of approval to operate, and failure to maintain compliance will result in the certification being taken away until violations are dealt with by the owner. To date, 25 barber shops, 13 spas, 48 hair salons, and 21 manicure and pedicure facilities have been given certificate of approval to operate. Detailed protocols can be found on the Ministry of Health COVID-19 website. However, they can be summarized using the following control measures: hygiene, cleaning and sanitizing, social distancing, and employee safety. As it relates to hygiene, for all facilities with protocols that have been established, hand wash stations or hand sanitizer dispensers must be positioned at the entrance of the facility. Hand wash stations must be equipped with liquid soap and paper towel, and a hands-free lined bin must be available for the collection of the used paper towel. The hand sanitizer dispenser must be filled with an alcohol-based hand sanitizer of at least 70% alcohol and must be checked frequently to ensure that it is always filled, or an employee can be given the responsibility to sanitize all customers and staff on entrance. Hand sanitizer must also be available for staff use, and dispensers must be positioned throughout the facility. There must be signage to encourage social distancing, hand hygiene, respiratory etiquette, wearing of masks, which must be visible and posted in conspicuous locations inside and outside of facilities. Mandatory wearing of masks must be enforced at all times upon entering the facility and for the duration of time spent at the facility. Masks are only removed during the meal at restaurants or for shaving of the beard or the mustache at the barber shops. Cleaning and sanitizing. Equipment, work surfaces, highly touched surfaces such as the doorknobs, the tables, the chairs, the restroom, countertops, linen hampers, and the waste bins must be sanitized regularly. The equipment, the table, the chairs, the gaming consoles, the smocks, the drapes must be sanitized after each individual usage. At the churches and other places of worship, cleaning and sanitizing must be done prior to opening if there are multiple services held on the same day. At least 1 hour between services for full sanitation of all areas. At the barber shops, the manicure and pedicure facilities, and at the hair salons, the solutions that are used for immersion of items must be changed daily, or when it becomes contaminated with nail filing, floating hair or debris, or it becomes cloudy. At the restaurants, tables must not be preset, and the menus should be on a fixed display and should not be handled by patrons. All single-use items must be discarded after use. All employees must have a basic idea of the cleaning and sanitizing procedures. All facilities must have adequate supply and appropriate cleaning and sanitizing products. Do not mix the chemicals that you use for sanitizing, especially if you are using bleach. This can create a potential health hazard. For social distancing, there shall be limited number of employees or customers inside of the facility based on the availability of space. For churches and other places of worship, the maximum number is 25 at church service, wedding, and funerals. At the restaurants that cannot allow for social distancing, they should operate by takeout and delivery only. All equipment, seating arrangements, gaming consoles at the gaming establishments must be placed 6 feet apart or removed to allow for social distancing. Physical markers must be placed outside of the facility, in the aisle, or at cashing counters to also allow for social distancing between customers. There should be no loitering outside of facilities such as the gaming establishment, the gyms, the barber shops, and the hair salons. Appropriate shields or barriers such as the plexiglass can be installed where they are required to separate workstations or gaming consoles. Facilities are encouraged to use e-payment systems, text messaging, or mobile ordering apps to limit contact. For employee or client safety, all employees or clients experiencing flu-like symptoms should not report to work or visit the facility. All employees are required to wear the appropriate personal protective equipment, such as the head coverings in the food establishment, your mask, your face shields, and they must be worn properly. All facilities must have a policy for the management of an employee or a client testing positive, to include temporary closure of the facility for sanitization of the premises, testing and quarantine of all the staff as per the protocols of Ministry of Health. And at the food establishments, all food handlers must be certified, and persons are encouraged to contact their environmental health officers within their district for further guidance as it relates to food handling certification. Individual responsibility and commitment to follow the health and safety protocols is key to the success of a facility's efforts. Employees and customers or the clients have to take the responsibility for their actions and adhere to the health and safety protocols of the Ministry of Health to protect themselves and others while helping to contain the spread of COVID-19. The purpose of the protocols is not to eliminate all the potential risks, but to provide a feasible path for operation within the pandemic environment. I thank you.
Thank you, Ms. John. We cannot stress enough the importance of following all health and safety protocols. This is the only way that we can safeguard ourselves, our clients, our human resource, and the general public. I urge the business community to please follow the protocols. Thank you for joining us. Have a good evening.
So we are in the community of Bells today. We are going through a list, making sure the community has a certain amount of people that get vaccinated. So we are raising awareness as well as education, as well as meeting the people, find out their concerns, why they want the vaccine, why they're not taking the vaccine, if they'll encourage their friends to take the vaccine. So all this is part of our vaccination rollout campaign. So stay tuned for more, and remember, vaccination helps. Get back today.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly. your family.
Take the vaccine.
To safeguard the elderly.
Take the vaccine.
To bring back with festivals.
Take the vaccine.
Take the vaccine.
Take it. Take the vaccine.
Take the vaccine.
Take it. Take the vaccine.